Let's talk about SBAR in nursing school. So what is SBAR? SBAR is used for when you are communicating patient information to someone else on the healthcare team. So it's a really great way to give them concise information. So S stands for what is the situation? S for situation. What is the current situation that you want to tell the other member of the healthcare team about? And then B, what is the relevant background information? You don't have to say everything about this patient. What is relevant to the current situation? And then what is your assessment? What are the relevant assessment points that are applicable to this situation? What do you need to tell this other person? And then recommendation. What is your request or what is your recommendation for treatment or plan of care for your patient? So it's really, really helpful if you give your request or recommendation so that they know, what you are hoping to achieve for your patient.